Hello, and welcome to the 2022 Employee Benefits Open Enrollment Meeting for Allesco Industries. Today's agenda includes the following. What is open enrollment? What's new for 2022? We will be discussing your medical plan, your dental plan. We will talk about healthcare reform and enrollment process, and we will also speak to the flexible spending account for healthcare and also dependent care, which is new this year. Open enrollment is an opportunity to make changes to your benefit elections and to review which dependents you will cover. Elections that are made during this period will remain in effect for 12 months unless you experience an IRS-approved qualifying event. Approved qualifying events include marriage or divorce, death, birth or adoption of a dependent, change in employment status, change in dependent's eligibility status, loss of or significant change to your current coverage, a judgment or decree or court order, and anyone who is Medicare eligible age 65 and older. Please note you have 30 days from the date of the event to notify Human Resources of those changes. What's new this year is that Allesco Industries is happy to report that there are no plan changes to Blue Cross Blue Shield of Rhode Island medical or dental plans for 2022. Blue Cross will also be issuing new ID cards for January 1st. These new ID cards will display deductible and out-of-pocket maximums. This is due to a recent federal mandate that was just passed. The 2022 benefit open enrollment period will begin December 7th of 2021 and will run through December 17th of 2021. What is new this year is dependent care FSA. There's a maximum of a $5,000 annual election per household. All benefit elections and changes will take effect on January 1st of 2022. Everyone will need to complete and sign the 2022 benefit election waiver form this year, as this is an active open enrollment process. If you are making changes to your plan or adding or dropping dependents from your plan, you will need to fill out the back portion of the 2022 benefit election waiver form. Anyone opting into FSA for 2022 will need to indicate this on the 2022 benefit election waiver form and also fill out a BCBSRI FSA enrollment form. All payroll deductions will begin January 7th of 2022, and the deadline to enroll this year is December 17th of 2021. What impacts your medical costs? Things like state and federal regulations. For example, Affordable Care Act, high utilization of benefits, somebody that may be hospitalized frequently throughout the year, or they have a great deal of testing done throughout the year. Unhealthy lifestyle choices. That includes diet and lack of exercise. Plan designs. Any type of new drugs or technologies and treatments. Also, an aging population. There are 6 ways to avoid unexpected costs. Avoid going to the emergency room if it is not an emergency. Call your primary care doctor first, or use a walk-in health clinic, or defer to your virtual visit, your telemedicine feature. Avoid paying too much for a test. Use the cost calculator at mybcbsri.com to compare prices and lower your costs. Avoid taking a brand name drug when a generic is available. Ask your doctor or your pharmacist if a lower cost generic drug is available and it makes sense for you. Getting a COVID-19 vaccine also helps to reduce healthcare costs and unexpected hospitalizations. Avoid using an out-of-network doctor. Choose one of the many doctors in the Blue Cross Blue Shield network. Review your healthcare services summary, also known as an explanation of benefits or EOB. This explains the cost of your recent medical care. Be sure to check your EOB against your medical bills. We will now begin to talk about your medical and prescription coverage offered by Blue Cross Blue Shield of Rhode Island. So one of the most common features right now that is very popular are what we call virtual visits or telehealth medicine. Blue Cross uses the doctors online for their vendor. These benefits allow you to connect with a doctor 7 days a week, 24 hours a day, up to 365 days a year. It typically will take a PCP copay. However, if you need to see a doctor due to COVID-19, Blue Cross is waiving that copay at this time. For common symptoms like cold and flu, sinus, ear and eye infections, headaches, and skin rashes, this telehealth benefit is very helpful. How you would sign up would be to download the Doctors Online app from the Apple App Store or Google App Store, or you can visit doctorsonline.com from your computer. You want to have your Blue Cross Blue Shield of Rhode Island member ID information ready, provide your contact and billing information. You would like to set up your username and password, and we do suggest that you register before the need to actually use it. Another benefit are the retail clinics, and these are CVS Minute clinics that are embedded in the CVS pharmacies throughout Rhode Island and Massachusetts. There's no appointment necessary, although you can set one up. This too takes a primary care physician's copay. And lastly, just a reminder about prescriptions is you can now get a 90-day supply at all participating pharmacies with a 3-month copay. This slide outlines the 2 plan designs that are offered to Allesco employees. The HealthMate Coast to Coast coinsurance plan that carries a $2,000 individual deductible, $4,000 family, along with the Blue Solutions for HSA, which carries a $5,000 per individual, $10,000 per family deductible. The deductible structures on both these plans are very different. With the HealthMate Coast to Coast, no one person on a family plan will exceed their own $2,000 deductible. Once that is satisfied, coverage will be 100% thereafter for the remainder of the year. On the Blue Solutions, it's different. If you have a family plan, the deductible is $10,000. That means one person can satisfy the entire $10,000 before the plan will begin to pay, or it can be a combination of your family members. The out-of-pocket maximums are slightly different for each plan. The $6,000 per individual on the HealthMate Coast to Coast is including any and all cost sharing. That means your deductible expenses, any co-pays that you pay, as well as any co-insurance, which are percentage-based co-pays. Once your individual out-of-pocket maximum is satisfied, your coverage is then at 100% for the remainder of the year, meaning you have no more cost sharing for your benefits if you were to meet that out-of-pocket maximum. That holds true also for the HSA. In this situation, the individual is capped at $6,550 for their out-of-pocket. Once that is satisfied, all expenses are covered at 100% for the remainder of the year with no additional cost sharing. This is a cap on medical expenses, so that is the most you will pay in medical expenses for the year. As you can see, there are additional benefits outlined here. I'm not going to go through all of them. I'll just give you a moment to look them over, but there have been no changes to these benefits. Preventive services are covered at 100% on your plan for in-network. These include 1 annual routine annual exam with your physician. Ladies, you get 2, one with your primary care doctor, the other with an OBGYN physician. Well baby visits are also covered from birth to 35 months. Preventive screenings and tests such as blood pressure, cholesterol, pap smears, lead screenings, PSA, mammograms, and colorectal screenings. Colonoscopies are also covered at 100% for individuals age 55 and over. This is not only for the procedure and the surgeon, 100% is also covered for the facility, the anesthesia, a biopsy if there's one taken, and the pathology of a polyp if there's one taken. We encourage everyone to have these done every 5 years, as it is a key factor in prevention of colon cancer. Also, adult immunizations such as flu, pneumonia, hepatitis A and B. And now more than ever, we encourage folks to get their flu vaccine. There's also some preventive medications that, if purchased with a prescription, are covered at 100%. Those are outlined below, as is preventive education and child immunizations as well. So we're going to talk a little bit about your prescription drug copays. As you can see, your HealthMate Coast to Coast coinsurance does have flat dollar copays for medications, whereas the Blue Solutions for HSA, these medications are first applied towards your deductible, and once your deductible is satisfied, you then have your flat dollar copays up until your out-of-pocket maximum is satisfied. So $10 for generic, $35 for preferred brand name drugs, and $70 for non-preferred brand name drugs. Drugs in this category also have generic alternatives, so they really want you to use those as they are just as effective as the brand name medications. For medications that are in the specialty, which are the 4th and 5th tier, these are very expensive medications, and 3% of the population take this for very chronic and critical illnesses, such as HIV, cancer, infertility, rheumatoid arthritis, multiple sclerosis, etc. These are only dispensed at a 30-day supply, and they usually have special handling, so they get mailed to your home. For mail order prescriptions, there are 2.5 copays for tiers 1 and 2 for the HealthMate Coast to Coast, and the same holds true after deductible for the Blue Solutions for HSA. Here are the 2022 medical and dental employee contributions. They have increased slightly for this year. So after reviewing your plans, you might ask yourself, what plan do I choose? Well, you'll want to review last year's medical expenses. Review your total claims costs, what you've paid out of pocket. And then ask yourself these questions. Do I anticipate any surgeries or hospitalizations for me and my family in the coming year? Do I prefer a higher deductible with a lower payroll deduction? Does that make sense? Or am I prepared to pay the higher deductible in case of an unexpected medical event? How do I maximize my benefits? First, be sure you're using in-network facilities and providers. Know where your urgent care facilities are near your home for minor emergencies. Also note that you can use your telehealth doctor's online mobile app for anything that is not life-threatening. Be sure to ask your doctor for lower-cost prescription alternatives, such as generic medications. Those will help to reduce some cost sharing. And shop around for pharmacies for lower prices. There is an app called GoodRx that will allow you to do just that based on your home location and the location of the pharmacies. It's a wonderful tool. Make sure that you and your family have your annual preventive services done every year. Again, prevention is key. Know where you stand with regards to your deductible and coinsurances before you have any services done. There's a cost calculator tool out on Blue Cross's website that will allow you to plug in a procedure, a doctor, and a location, and you'll have an estimate of what that service may cost you. And check your explanation of benefits, the EOBs that Blue Cross sends to you, to be sure that those charges are accurate. Oftentimes, doctors make mistakes too, and they will send a claim that does not belong to a particular member, and Blue Cross pays for it. So just be sure that those claims and those charges are valid, and if they are not, be sure to contact Blue Cross Blue Shield to have them review it. This next section talks about flexible spending account, or FSA, for healthcare, and a new dependent care FSA as well. These programs are administered through London Health Administrators. For flexible spending accounts for healthcare, or FSAs for healthcare, as we mentioned, London Health Administrators is the vendor that manages this program. All FSA contributions are tax-free and are payroll deducted. You can access these funds via a debit card and/or a manual claim reimbursement. Participants are allowed to use the full annual pledge amount on the first day of the plan year. So as of January 1st, your full plan election will be available to you. The end of the year balance, or rollover feature, members can roll over up to 500 of unused funds from the current plan year to be used throughout the new plan year. The contribution maximum for 2022 is $2,850 per year. You cannot change your payroll deduction amount after the enrollment period unless you have a qualifying event. Eligible expenses include deductibles, copays, dental, and vision expenses. There is a run-out period. Members have 90 days from the end of the year to submit claims for reimbursement that were incurred during the plan year. You cannot be enrolled in your own HSA plan with your own financial institution and also opt into the healthcare for FSA. The plan year is 1/1/2022 to 12/31/2022. And this is only available upon open enrollment each year. Allesco Industries is now offering a flexible spending account called the Dependent Care Account, or DCA account. FSA contributions are tax-free and are payroll deducted. Participants can debit any funds that have been deposited into the account. So, for example, money in equals money out. There won't be a full election available to you on the first day of the plan year. This program runs differently than the FSA for healthcare. So an example is if you have $500 in your account, you can withdraw up to $500. For the end of the year balance, there is no rollover feature with this program. Any unused funds at the end of the year are forfeited. The contribution maximum is $5,000 per year per household. You cannot change your payroll deduction amount after the enrollment period unless you have a qualifying event. Eligible expenses include daycare expenses from a licensed daycare facility. You may access funds via a debit card and manual claim reimbursement. The plan year is 1/1/2022 to 12/31/2022. And again, you can opt into this at open enrollment. It's a one-time of year election. So how do you maximize your FSA? You would contribute tax-free dollars up to the IRS limit. You would save based on your spendable income that stretches an average of 30% further, and you can spend those dollars on qualified healthcare expenses. As we mentioned, FSAs are pre-tax spending accounts that are funded by the employee. Money in the FSA can be used to help employees pay for qualified expenses according to the IRS publications 502 and 503, such as medical, dental, and vision expenses. Since FSAs are funded by pre-tax dollars, the employees increase their take-home income by paying less in payroll taxes. This slide outlines an FSA tax advantage for employees. It gives you a snapshot as to what the savings are at the end of the year. It may not seem like much, but every dollar counts nowadays. The scenario you have in front of you are two individuals making $38,000 a year. One of them opts into the FSA program and the other one does not. Obviously, the one that opts into the FSA program has a tax advantage, and their annual income is reduced by the amount of their election. At the end of the year, the take-home income increases by $133, and that's in your pocket. Funds in the employee's FSA can be accessed by your debit cards or online through the Blue Cross portal, or you may mail in claims for reimbursement. And this is just a snapshot of what that debit card looks like and what the claims portal looks like on Blue Cross's portal, as well as the mobile apps and an actual claim submission via fax or email. The next section that we're going to talk about is the dental, and that will remain with Blue Cross Blue Shield of Rhode Island. Outlined here are your dental benefits with Blue Cross Blue Shield of Rhode Island. There is an annual deductible for major services, which is $50 per individual or $150 per family. There is a cap of $50 per individual on a family plan. There's also an annual benefit maximum of $1,200 per calendar year. Preventive services are covered in full at 100%, and these include one oral exam and 2 cleanings. These are per calendar year, which runs January 1st through December 31st. Major services such as periodontics, crowns, bridges, and implants are covered at 50% after deductible. Orthodontia services are also offered on this plan for dependents up to age 19. That has a $1,200 lifetime maximum per individual. Braces are also covered at 50%. Dependents on the dental plan are covered until age 26. We've now come to the segment regarding resources. Lowering the cost of a healthy lifestyle. These offers and discount programs are offered by all of the Blues across the nation. It's called Blue 365. The Blue 365 program makes healthy living simpler and more affordable. You get significant discounts on the programs and services that mean the most to you, such as fitness center discounts or athletic wear, equipment discounts, personal care, hearing aids, skin, vision, dental, any type of lifestyle discounts, for example, hotel and travel, and so much more. You must be a registered member on mybcbsri.com in order to take advantage of this wonderful program that the Blues offer. And again, this is across the entire country, so everybody in any state can access these programs. Some additional helpful tools are Find a Doctor, and you can log in to access that on mybcbsri.com account to search for providers or doctors and or hospitals. You can view their performance awards that doctors have earned. You can opt into something called Your Blue Wire, and you're opting in to have personalized text messages such as a flu shot reminder and health plan updates sent directly to your mobile device. You would text BCBSRI to 73529 to get started, or you may call 1-844-779-8820. There's also a wellness platform that will help you to live a healthier lifestyle, and you'll find tools there to improve your health and well-being, including a health assessment, fitness trackers, tips on eating well and or reducing stress, and much more. And you would locate that at mybcbsri.com, select self-service, select Tools and Resources, and select Virgin Pulse, and you can get started. Blue Cross Blue Shield also offers a wellness program. They partner with Virgin Pulse, and together they have a program that is very robust and offers members a great deal of discounts and features. Virgin Pulse also has a mobile app that you can download and you can access to track your progress for daily activities or healthy habits. There are daily cards that come up with helpful hints and tips on healthy lifestyles and healthy choices. Also, you have an opportunity to set up challenges either with friends or with your company. And there's also an opportunity to sync your steps with a Fitbit, or even some of the software that Apple has is compatible with the Virgin Pulse. So please remember to download that and use that to your advantage. It's hard now to get out to gyms, so if there's anything you can do remotely to benefit and increase the state of your health, this is one application you don't want to miss out on. The wellness platform powered by Virgin Pulse allows you to do healthy things, earn points, get rewarded while you're doing so. Once you've created a Virgin Pulse account, you can set your goals and interests, establish and maintain a snapshot of your well-being progress, and do other fun things like invite friends or join challenges and discover healthy tips. The more you do, the more points you'll earn. Each quarter, your points reset, giving you another chance to meet or surpass your healthy living goals. Access your wellness program in 4 simple steps. Download the Virgin Pulse app through the Apple Store or Google Play, or visit mybcbsri.com to sign up. Register your account, select Blue Cross and Blue Shield of Rhode Island as your sponsor, and then if you have a Fitbit, you can connect your Fitbit or any other wearable device to track and sync steps with the app. You can begin to earn up to $300 in rewards by making fitness fun. Your wellness program from BCBSRI is powered by the fun Virgin Pulse app. It's easy to use and it's very rewarding. Set your own goals, track your healthy activities, and challenge your friends. You can redeem rewards for gift cards from Amazon.com, Nike, Target, Kohl's, and more. How you get rewarded and how you can earn up to $300 a year is there's a $10 quarterly payout with 500 quarterly points, or a $30 quarterly payout with 5,000 quarterly points, $50 quarterly payout with 10,000 quarterly points, and $75 quarterly payout with 15,000 or more quarterly points. You track your rewards and points or your dollars earned. You can redeem your rewards as you earn them, and you can choose from a wide selection of rewards, including gift cards from Amazon, Nike, Target, Kohl's, and more. And you can also donate your rewards to charity if you like. There are 3 ways you can get help from Blue Cross Blue Shield of Rhode Island. You can call a toll-free number 1-800-639-2227, or you can click your plan information by logging into mybcbsri.account, or you can come by and visit the Blue stores in Cranston, East Providence, Lincoln, and Warwick, and visit your Blue store at bcbsri.com. Now we'll talk about the enrollment process. For 2022 enrollment process, if you do not want to make any changes to your medical and or dental coverage or add or drop any dependents, you are still required to complete the 2022 benefit election waiver form and return it to HR. All employees will receive a new medical ID card for 2022. Please remember to fill out a 2022 benefit election waiver form if you are making changes or if you are declining coverage. If you are enrolling in the Healthcare FSA or Dependent Care FSA, you must fill out the FSA election form provided by HR and return it to HR no later than December 17th. This will ensure that the debit cards arrive timely. I would get these in as soon as you are able to. No benefit enrollments or changes are accepted after the open enrollment period unless there's a qualifying event that occurs during the year. And if you are declining coverage, please review the Rhode Island individual mandate. Just as a reminder, Rhode Island does have an individual mandate. It was enacted back in 2019 as part of the 2020 budget legislation. The law that went into effect for 2020 requires individuals in Rhode Island to maintain acceptable health coverage or pay a penalty effective in 2020. The Rhode Island individual mandate mirrors the federal individual mandate requirement under the Affordable Care Act, which was eliminated at the beginning of 2019. Rhode Island's individual mandate requires most individuals in the state and their family members to be covered under minimum essential coverage for each month of the year beginning in 2020. Individuals that don't obtain acceptable coverage will be penalized. Rhode Island's individual mandate penalty is calculated in the same manner as the ACA's individual mandate, the greater of the two amounts. The flat dollar amount is $695 and $347.50 per child under the age of 18, or the percentage of your annual household income amount, which amounts to 2.5% of annual household income. Rhode Island law requires individuals to indicate on their state income tax return whether they and their family members had minimum essential coverage for each month of the year. Some exemptions apply. We want to thank you again for your participation in this year's open enrollment presentation. Please remember, all election changes are due by December 17th, 2021.